Welcome to 19 to Zero's webinar series on COVID-19 vaccines. This webinar is about the two Health Canada authorized mRNA vaccines. This slideshow was developed by a multidisciplinary team of nurses, physicians, pharmacists, and public health experts, and it's up to date as of February 24th. At the time of this recording, more than 21,000 Canadians and 500,000 Americans have died of COVID-19 in the past year. Many survivors struggle to return to normal life after a COVID infection. So, there's good reason to be vaccinated for your own health. You simply cannot know how you personally will be affected. Our aim is for healthcare workers to get educated about the vaccines, to get vaccinated in order to act as a role model for others, and to get skilled in communicating about vaccines with patients and colleagues and community members. The SARS-CoV-2 genome was sequenced by scientists within a month of doctors noticing a mysterious respiratory illness taking hold in Wuhan, China. This allowed for researchers to begin vaccine development immediately, before we even really understood the scope of what was to come. A diverse array of vaccine types emerged in the hopes that at least one would fit the bill. As mentioned above, in this slideshow, we'll focus on the mRNA vaccines. There are two mRNA vaccines authorized for emergency use by Health Canada. These vaccines were developed by Pfizer and Moderna. Both of them require 2 doses of vaccine to be maximally effective. The Pfizer vaccine is approved for people 16 and older, requires 2 doses 21 days apart. The Moderna is approved for people 18 years and older, requires 2 doses 28 days apart. The second dose can be extended further beyond that. Both the mRNA vaccines are incredibly effective. Importantly, for this particular disease, there are several different ways to look at vaccine efficacy. Most importantly, when we hear that vaccines are about 95% effective, it's referring to how effective the vaccines are at preventing symptomatic disease. As we know, however, the severity of COVID-19 symptoms is variable. It's also important to know how effective is it at preventing severe disease, at death, and how effective is it at protecting against transmission? The news on the first two is remarkably reassuring. No one in the vaccination arm of any of the clinical trials became ill enough to require hospitalization, and none of the vaccinated participants died. There still isn't enough information about the extent to which vaccine prevents transmission of the virus. So, until we have those data, existing public health recommendations remain for vaccinated people. Unpublished data from Israel demonstrate that mRNA vaccines perform well outside of clinical trials as well. In a population of 1.2 million people who got the Pfizer vaccine, there was a 94% decrease in symptomatic infection, just like the trial, and a 92% decrease in serious illness, and maintained efficacy across all age groups. So, how do mRNA vaccines work? mRNA stands for messenger RNA, which the body uses each and every moment of each and every day to tell ribosomes in our cells how to make certain proteins. It's sort of a recipe book. Proteins are made of different combinations of amino acids. The mRNA tells the ribosomes what order to put those amino acids in to make a specific protein. mRNA vaccines contain mRNA encased in a lipid capsule. The mRNA has the recipe for part of the spike protein that's on the COVID virus, which our bodies will then identify and make antibodies against. So if the virus enters our body in the future, our body will recognize it and mount a rapid immune response to kick the virus out before we can get sick. One of the most promising things about the mRNA technology is that as we see new variants of the SARS-CoV-2 virus causing changes on the spike protein, we can change the recipe of the mRNA to respond to those changes. The vaccines do not contain the actual virus and cannot give you COVID. The mRNA does not impact your DNA and does not last in the body. It sticks around just long enough to do the job. People who are sick with COVID-19 should wait until they have fully recovered from the virus before becoming vaccinated, as should individuals with other acute illnesses. People should wait to receive the vaccine if they have received another vaccine within the past 14 days. And vaccines should only be administered to the approved age groups. Some considerations do need to be given when determining whether certain populations should take the vaccine. Rarely, severe allergic reactions can occur in response to mRNA vaccines. People who have a history of severe or anaphylactic allergic reaction to this vaccine or any of its ingredients should avoid this vaccine. For this reason, there's an observation period following vaccination for 15 minutes without allergy history and 30 minutes for those with severe allergy history. The vast majority of allergic reactions occur in this time frame. Outcomes for people who experience anaphylactic reactions after vaccination were good. The current rate of anaphylaxis being reported by vaccine adverse event reporting surveillance is 5 per million doses of Pfizer and 2.8 per million doses of Moderna. People with blood clotting disorders can still safely get the vaccine. There's no need to pause anticoagulants for the shot. Apply pressure to the vaccine site for at least 5 minutes to ensure adequate clotting. There is no safety data for individuals with autoimmune disorders or the immunocompromised. Those individuals should discuss the vaccine with their healthcare providers and weigh the theoretical risks of the vaccine with the very real risks of COVID-19 infection. The main concern in this population is not safety, but rather uncertain immune response. Clinical trials for the mRNA vaccines, including pregnant individuals, are being conducted now. The pregnant women in the studies so far have not been reported to have bad outcomes. Patients who are pregnant or breastfeeding should be offered vaccination at any time if they are eligible, and if no contraindications exist. Pregnant individuals should consider the following when deciding whether to be vaccinated. They should remember that the vaccine is not a live vaccine and does not pose any risk for causing COVID-19 illness. There were 46 unintended pregnancies in the Pfizer and Moderna trials, and no adverse outcomes reported. Animal trials for the Moderna vaccine included no adverse outcomes. VAERS has reported over 15,000 pregnancies in the vaccinated public. Pregnancy is a risk factor for more serious COVID infection, including hospitalization and ICU admission. Infants under 1 year of age are also considered higher risk for severe COVID. All of these facts weigh towards taking the vaccine in this population. In clinical trials, it's important to realize that the vaccines work just as well in those over 65 as in younger populations with fewer side effects. In both the Pfizer and Moderna trials, between 35 to 40% of the population was Black or African American, Latino, and Hispanic. The vaccines were equally effective in any and all of these groups. Like all vaccines, there are some side effects associated with the mRNA vaccines. Side effects for the Pfizer and Moderna vaccine are similar. Most people can expect to feel a sore arm, tiredness, and headache as the vaccine starts to work. Some people will feel muscle aches, chills, or a mild fever. Reactions at the injection site will improve by 48 to 72 hours. Around 1 in 10 people will want to take acetaminophen or ibuprofen, and much less often, people may experience enlarged lymph nodes. You can see that reports of side effects for the Moderna vaccines are similar to the Pfizer symptoms, but have a slightly higher incidence. All of these side effects are caused by activation of the immune system. So they're actually a great sign that your body is mounting a response, just as we hoped. For this reason, you can expect the side effects to be somewhat stronger with the second vaccine, as opposed to the first, as your immune system will have a more robust response. We do need longer-term follow-up to understand how long you will be protected. Protection begins a number of weeks after the first dose and is best after the second dose. It is likely that if you have had COVID-19, becoming vaccinated, even just once, will protect you for longer. Thank you for tuning in to our COVID-19 vaccine webinar. We hope we helped you feel confident getting your COVID-19 vaccination so that we can move towards a brighter future together.